Welcome to the Holistic Equine Academy of Lymphedema. I'm Teresa Mueller. Well, welcome. We finally made it. Uh, that was an ordeal. We had a little bit of a confusion with the link. I think we got it straight now. I sent out the emails for other people to join. So if they don't, at least this is going to be recorded for them. And I just hope that they join in. Let me just check the email to see if they sent anything back. Nope. I don't think so. All right, so we're going to get started here. Anyway, what this to me this is the foundation of the lymphatic system. It's a piece of it, and most people don't even know it exists. That's very frustrating. So I'll give you a really quick synopsis what happened. I went through several different classes of manual lymph drainage, and they talk about the highway, which is great. I get that. But they didn't talk about the connective tissue. So somebody had said, "Oh, they were talking about Lotto's compendium. His compendium's wonderful." And I said, "You know what? I think I better read this thing. Yeah, I might learn something." And let me tell you, it was an eye opener. It was all about connective tissue. And then I said, "Now the light bulb went off, and I'm going to share the light bulb moment with you." All right. So this is the foundation. Right underneath here is where the action is, and nobody knows it. You are now going to know it. And you're going to be one of very few people who get this. So this is important. So last week we started out with the first webinar, which was be part of the research. So Donna, I'm going to ask you a question. What did you think of that webinar just about the information?
I thought it was good. I thought it was useful. And the discussion, we had a little discussion afterwards too. It was helpful.
Good. Well, B.E. Myers, I don't know if you were there last week, but I'm gonna give you a quick synopsis of what happened because to me, you need to understand the market and what the opportunities are and what we're missing. By the time we get through these next 5 or 6 slides, you're going to begin to see a pattern. You're going to see a pathway. Say, "Oh my God." So let's go over this. Anybody who wants the replay from last week, let me know. I'm just going to send it out in the email. So each week when we do a webinar, I'll just add what do you call it? The replay on it for everyone. All right. So we've got 9 million horses in the United States. That's an approximation. 8 to 10% are impacted with chronic progressive lymphedema or chronic cellulitis. Where did this come from? As I started out, there was no information at all on the number of horses impacted. So I started what we call be part of the research. And this is where I did not solicit this. This people came to me and we estimated anywhere between 8 to 10% of the horses have chronic progressive lymphedema or we've got some cellulitis going on. So what it is, it's actually an acute swelling disorders. That's what this is. And this is breed specific. You can look at CPL is predominantly draft crosses because that's my specialty. And also we have thoroughbreds and they're the number one breed for cellulitis that's coming in on the research. So this is really important. The acute phase runs about $1,200 or $1,500 a year. The reoccurring phase, it could be anywhere from 1.5 and up or two times a year. You'll look at it at 750, between 650 and 750. Through the average between 3 to 5 years, the owner can anticipate $10,000 to $15,000 in vet bills. And here's the sad part. Ready? The chronic swelling does not go away. So, what are we spending this money for? So, the financial impact, after all it's said and done, is approximately $828 million. Okay, it's being recorded. Somebody said somebody's at work. All right, let me just. All right. So when you think about that's a lot of money. I'm talking for two conditions, CPL and cellulitis. Doesn't mean everything else that we're going to talk about now is in that number. It's not. It was predominantly chronic progressive lymphedema and cellulitis. All right, so let's take a look at this. Why is this so important? This is right underneath the skin, and I'm going to explain this to you. All right. And so I want you to take a look and think about homeostasis. When you think of homeostasis, what comes to your mind? Donna?
Um, is it, can you hear me, Teresa?
Yeah,
Okay. Is it having the body, and when the body is in complete, um I want to use the word alignment, but I know that's
that's
not,
good. That's fine. So that's how you see it, right, Donna?
I think that's what it means.
Okay, how about you, Christina? You want to type it in? Okay. Anyway, here we go. Let's take a look at homeostasis. So here's what happened. All right. As I started understanding CPL and cellulitis happens right underneath the skin. This is the skin. All right. Do you see where it says lymph vessels down here?
Yeah.
It goes right through the skin. So it's directly beneath the surface of the skin. Do you get that? This is what's underneath this section here. All right. So, so when a horse comes down with CPL cellulitis, cellulitis is usually a cut on the skin where bacteria gets in the skin and then this area gets infected. And let me tell you, cellulitis hurts. It is
Hmm.
painful. If you ever had it, you want to cut your finger off. I had it one time in one of my fingers from a hay splinter. I'm telling you, it will drive you mad. It throbs, and it hurts, and it can be very dangerous. A horse that comes down with cellulitis at 7 o'clock in the morning has the potential to have a destroyed lymphatic system by 7 o'clock that night. It works that fast. This is the space that it's happening. So if you were to take this space here, put it under the microscope, this is what you're looking at. This is where it's happening. Why? Look at this. We got a white blood cell here. We got macrophages. We have things in the immune system to help combat infection. And that is built right underneath the skin. Does everybody follow me? You
Yes.
okay? Okay. All right. So, what is homeostasis? Homeostasis is the body's ability to manage the balance of the body. You got fluids, you got metabolic processes, you have all these things going on. So, in my mind, I'm saying, gee, I'm seeing cellulitis, I'm seeing laminitis, I'm seeing all these conditions, and all these conditions are directly underneath the skin. So, I'm saying to myself, homeostasis. How much does the loose connective tissue, now the tissue is like the tendons and the ligaments, okay? I'm talking about loose because this is exactly, there's no tendons and ligaments underneath the skin right here that I'm pulling on my hand. So I said to myself, gee, I wonder homeostasis, what part of the homeostasis is the connective tissue, the loose connective tissue, a part of? Is it 60%, 10%? What player? And I was trying to wrap my head about around it. So my husband had an appointment with our primary care physician. I said, when I go in, I'll speak to her. So when we went in there, lo and behold, at the end of the visit, there was a gentleman that she had introduced at the beginning of the visit who was a medical student doing an internship with her. So we had the intern there for medical school and now the doctor. So I said to the doctor, I said, before I leave, can you just help me out here? I'm trying to wrap my head around this loose connective tissue and what part of homeostasis does it play? 50%, 10%? What are the critical players? Well, I'm going to tell you what. You thought I pulled the rug out from underneath and they couldn't answer it. I swear to God. They said, and she panicked. I could see it on her face. And she says, "Oh, Teresa, but you know, the body is very complicated." And I said, "Yes, I know the body is, but I'm trying to uncomplicate it. I'm trying to understand something. I was just looking, Donna and Christina, for information to either validate it, I was just looking for information to have a conversation so I can wrap my head around all this." So I asked the medical student. He just looked at me. He didn't say a word. I said, "Well, you're in medical school. What did they tell you about homeostasis and where it starts? And what role does this connective tissue?" Zero, nothing. They were mortified. Red flag for me. That's the God's honest truth. So let's get into this right now, what I'm talking about. All right. Could the lymphatic system and loose connective tissue be the missing piece understanding common conditions? I believe so. These are not all the conditions. I'm just highlighting the ones that came to mind. So there could be many, many more of them, but I'm just giving you a taste of why this is so important and why we need to understand it and acknowledge it. First of all, intermittent leg or chronic swelling, even in the groin, chronic progressive lymphedema is really for drafts and draft crosses, or any kind of chronic limb swelling is happening right here in this loose connective tissue. It's happening right underneath the skin. So if you look at the skin here, all right, if there is a cut, cellulitis is done by a cut, get bacteria in it, and then it infects this area here, and this is what you're looking underneath here. This here is the dermis. You see where it says dermis? You see that, folks?
Yeah.
Donna, you see it?
Yep.
That is what this is. The dermis is a part of the loose connective tissue is a part of this dermis. Okay, so if you were to take this and put it under here, this is where it would be. Okay, so when you think dermis, there's a segment of the dermis that is loose connective tissue. This is what it is. So now that let me go over what's in this picture. Again, white blood cells. This is immune macrophages. It's immune. Mast cells. If you ever had the hives or your horse has had the hives, this is the rascal that gets worked up. Now, underneath that, we have elastic fibers and collagen fibers. Well, just so you know that all elastic fibers run parallel to collagen. If there is bacteria in here, let's say from cellulitis, and most of cellulitis and CPL swelling is predominantly a combination of strep and staph. So when that bacteria gets in here, it eats away at the elastic fibers and it breaks down the skin. So now you can't move anything. Everything is like this, swollen, and there's no ability for it to move. So next week we're going to be talking about the see, touch, and assess method, and I'm going to tell you how I used it. It validated that I had to euthanize one of my horses last month, and how I used it because right here, when I did the see, touch, and assess, this loose connective tissue was getting resistant, and other places it was totally restricted. Other places it was filling up. He had beautiful lymphatic flow in his front extremities. When I tested him, when the vet came to euthanize him, I said, "Let me just check this one more time so I know what I'm doing." His legs were filling up. So I knew that the lymphatic congestion was moving from the rear up to the front of the body. And then I knew he wasn't in pain. He was just uncomfortable. There was a very deep impaction in the colon. And that was the ultimate, it was a lifesaver for me. I knew I had to do it, but what the See, Touch, and Assess that you will learn, it is free. It is on our website, and you can go on it and take a look under resources, and you'll see lymphatic library, and just scroll down to where you see identify lymphatic congestion, and you will learn how to do it in 2 minutes or less. And let me tell you, it was amazing. And I can sleep at night. I could actually feel, was I happy about it? Of course not. But it validated everything that I'm teaching here tonight. So it was just great. So what is cellulitis? Cellulitis is heat redness, pain, and infection. And let me tell you, when you get infection, it is dangerous because it goes right through the system. Now, here's the other thing. When somebody gets a tattoo, they break the skin and they're putting the ink. The ink gets into this loose connective tissue, and what eventually goes into the lymphatic system, and the ink will turn the nearest node to blue or black. And that is something Professor von Ruttenfeld discouraged. He said that was not a healthy thing to do. He never said what caused it, he just said he didn't recommend it. So, and I can understand why when we talk about lymph nodes, they're there to seek, trap, and destroy. So now the node is congested with, some of the element they can't get rid of. So that has a potential to could run havoc on people. People live with them for years and have no problem. But I'm just telling you that this is a little bit more sensitive than most people think. All right, scar tissue. Here we go. Scar tissue is important because connective tissue, if something tears, this immediately the collagen and the elastic fibers get to work to repair it. Now, here's the thing. With scar tissue, lymph doesn't pass scar. So what are we talking about? How about geldings they have swelling in the groin? Because what happens is when they got gelded over the years, the scar tissue formed, and of course there's a little bit of fibrosis, and can't pass scar, so the whole sheath swells up. So if you got horses, particularly you'll see it more so in geldings, and you'll see a swollen sheath. That's going to tell you that this here up here. Let me right there has been tampered with because it's directly underneath the skin. Professor von Rottenfeld said there's a very specific place where you geld a horse where there's no lymphatic flow and you wouldn't interrupt it. I do not know where that is because I don't do I don't geld anything. I don't I'm that's out of my scope of practice. So I just wanted to give you an idea. Now we're going to talk about unable to sweat. Anhydrosis. Okay. Anhydrosis here is the ability for the horse that can't sweat. Well, in this picture here, you don't see a picture of the sweat gland. You see the sweat pore, but it's right in here. It's in the dermis. Now, what's interesting about the sweat glands, they can get infected and they can actually disappear. So if they disappear, it's because there's probably some sort of infection or bacteria, something's going on there that they disappear. So there was an article, it was a wonderful article written by a gal down in Georgia, and she says the FDA hasn't been able to find a cure. And I'm saying, I don't think it's a cure that you're looking for. I think it's a congested lymphatic system. And why? Because it's directly underneath the skin, and this is the loose connective tissue. I'm not saying that once that is that all horses could eliminate, be cured, or I wouldn't say cure is the wrong word, but could benefit. Well, every horse can benefit from a lymphatic drainage because you're going to open up the pathways and you're going to free up this congested area here, which is this here, to move it. So what I'm saying is here, if those sweat glands get clogged or they get destroyed from bacteria, the body has no way to move the sweat. So I think that in many, many cases, what we're looking for, it's not medication, it's not acupuncture. What we're looking for is a congested lymphatic system. And this is where it's at. Right in here. You take this and you put it into there. All right. Laminitis is another one. Laminitis is an inflammation. So when they say inflammation, anytime you use the word inflammation, you're usually saying there's a reduction of blood circulation. When you have reduction of circulation, you're going to have lymphatic backup. You're going to have a lymphatic issue. So there's a potential here. I really believe that with laminitis, that is certainly something that we could look into. We have no practitioners who are specializing in that. I would love to have a practitioner, who says they had a really great experience with laminitis. Are we going to cure that? No. What we're going to do is clear the pathway so the body could reset itself. And that's what we do. We'll talk about that when we get into MLD and in 2 more weeks, because then we'll get into a little bit of the anatomy of why that happens. Now we got a lot of abscesses. Abscesses come all the time. Now, if you're a big fan of Dr. Pole, he was always lancing these abscesses. Does anybody watch him? Donna?
Um, where do you see him? Do you mean he's on Facebook or something?
No, he's on YouTube or whatever. Dr. Pole, I
No,
don't know if you're okay. Okay, anyway,
no, I don't know.
somebody may have. Well, anyway, he's a veterinarian that they followed for many years, and he was up in Michigan, and he's always lancing abscesses. And what it is, it's bacteria that got stuck, ready, in the connective tissue. Nobody ever talks about that. And I'm like, that's why you don't give a horse an antibiotic for an abscess because it's stuck in this tissue. And once you lance it and drain it and flush it out, now the white cells, the macrophages can go to work and do their job and clean it up. Now we're talking metabolic syndrome, Cushing's, and other endocrine disorders. These are impacted because within this, you see all this green, this pink stuff. Let me see. You see the pink here? You see that, Donna?
Yeah, yeah,
That's called ground substance. And ground substance is like your cooking stock from chicken or beef or turkey, or pork, whatever. You put in the pot and you're making soup, and you ever see the chicken gel? And you make a gravy from that, that's ground substance. Okay. And we have it directly underneath the skin. So when you do the see, touch, and assess method and you feel resistance, that means that ground substance is clogged because there should be more fluid. You should be able to move it. So when this gets stuck because everything is so swollen, nothing is moving. The only thing that's doing moving are the bad guys. Unbelievable. So this is why I said this photo here, this to me is where the rubber hits the road. For every condition that we look on a horse, the first thing I ask myself, what's the connective tissue link? Is it directly, what are we looking for? We're looking, most of it is going to be directly under the skin. People don't even realize how important this is. They're still trying to find a cure for, you know, for the horse to sweat when they get clogged. I really think it's a clogged lymphatic system. How do I know that? Because we've had horses that were diagnosed with angihydrosis, and when we did the lymphatic work on them, it cleared up. Why? Think about that. So that is why this here becomes so important. So when you go down the road and you're looking horse one, horse two, and they have these different things, I want you to go back and go look it up. If you're not, contact me. I'll be more than happy to talk to you about it. I can certainly learn something from it myself as well, and understand what's going on in this section here. So I think it's very, very helpful. So any comments, Donna?
no. It's
Did you
all it's all really, really interesting. The laminitis, the anhidrosis, all of this. And a lot of horses suffer from those things.
Yeah, they do. Cellulitis, right? These
Yeah,
are very common things. And we didn't get into this, but there's fat pockets, okay, on the horses. People say, oh, they got fat pockets. I don't think that so much fat pockets. I think it's congested lymph. That's my opinion. That's an opinion. So this is why I said this is the foundation. Now, let me ask you this. Can you understand? Let me go this way. How the number can get up to 828 million dollars a year?
yeah,
Do you see the connection?
yep, yep,
Okay. So you're talking about acute swelling disorders. This is predominantly CPL, but androidosis is not included in that number. It's not. Scar tissue is it, laminitis is it, abscess is it. So can you see the relationship between what somebody is paying for and maybe something as simple that's under $300 for a horse owner to fix? Would you rather spend 300 under $300, or would you rather spend anywhere between 10 grand and
Yeah.
$15,000 and not have results? So,
Yeah, the 300.
yeah, right. So what I'm asking everyone to do is join the lymphatic movement. And one of the things that the lymphatic movement, and we're on Facebook, and I'm going to put together. I want to do a weekly session because I want people to call in and tell me what are their problems. And I bet you 9 times out of 10, we're going to see something like this. But this is an educational tool. So that's why I think it's important that people join the lymphatic movement, only because we want to change how we're managing our horses from a lymphatic point of view. So what's on the agenda for next week? The grooming technique. This is very important. Now that we talked about how big the market is, we talk about the money. We know it's quite a bit of money that people are spending that they don't have to spend, most likely. And now you see the relationship between the loose connective tissue and how many problems are occurring just simply because we don't understand how this operates. So now when we go into the professional grooming technique, we're going to give you the hands-on skills, the see, touch, and assess method to identify where the lymphatic congestion is. And why is the grooming technique? And also we're going to be talking about the direction of the hair next week. Important, because the direction of the hair is not random, it is strategic. It's strategic. And we'll talk about why is it strategic. And then I'm going to give you a homework assignment to go look at your horse, go to their face, go to their neck, go to their shoulder, their legs, their abdomen, the hindquarters, and take a look at what the direction is on the hair, because we're going to talk about that exclusively next week. And then go do the see, touch, and assess. That's what I'm doing there, that assessment on the legs. And then you'll understand, gee, now I understand the lymphatic flow. I think I really have a potential to heal and make a difference. So that is the conclusion for tonight's webinar. Short but powerful. Any comments?
I have a question.
Ask.
So, next week, when you go over the direction of the hair, will you talk,
Yeah.
because I have a mare that has a lot of whorl, on her neck. I mean, she's got whorls all over. So, I mean, does that affect how you would be addressing the direction of the hair as well?
The direction of the hair, you got to look at the direction of the hair because that's going to be strategic for sure. What I want you to do, Estelle, is go to the be part of the research on our webpage, fill out, and I'll talk to you directly personally. Let me
Okay,
get me some pictures and I'll help you with that.
okay, sounds good. I'll have to check out the website.
All I need you to do is just go to our website and click on, I'll do that now. Let me ask one more thing. Don, do you have any questions about that?
No.
All right, so stay tuned for next week. You're not going to want to miss this because this is talking hands-on, and I'm going to talk about what happened when we had to put Tom down last month and how I used it, the see, touch, and assess method, and how I used the grooming technique, and in a colic situation. Everybody's is different, but these are just little tools and just things for you to remember. You have any other comments?
No, it's been very interesting.
What did you think, Estelle?
Been very interesting. I look forward to catching up, getting the replay for last week, and I look forward to next week too.
What did you think about this theory?
I think it makes sense. It's just another thing. So I'm a human massage therapist as well. Um, and I think it's just another thing when you talk about homeostasis, it's creating uh, your bodily systems that are functioning optimally so that they can, you know, basically if you have something that's wrong, something is not functioning optimally. So you're facilitating that.
Hmm. Right. So this resonates with you because you're a massage therapist. So
Yeah,
let
and
me,
I love all, natural health care, things like that. So,
yeah, but let me ask you this, all right? How much time when you were in massage school did you spend on loose connective tissue?
oh, not much.
Okay, that's why. You
They're
see
there to
that?
educate you on the basics, I mean, and you have to learn things that for some reason you have to learn things that you're never ever going to use.
Yeah, but see this, but you see, you realize how I'm a massage therapist. I still work on people.
Yeah.
And my point is, here's my point on this though. When I look at someone, the first thing when I touch their skin, I'm thinking connective tissue because that's the only thing when you think about it, Estelle, that's the only thing we can impact. Think about it. It's just the top of the skin. You need 2,000 pounds of pressure to move a muscle. Did you know that?
Wow.
Yeah.
No, I learned that a couple of weeks ago. I was taking a class and they said it takes 2,000 pounds of muscle strength to stretch a muscle. Well, I don't have 2,000 pounds.
That's two horses.
So what are we really doing when we touch just beneath the surface? Think about that, Estelle, from a
Yeah.
massage perspective. What are we
Yeah.
really facilitating?
Well,
What
that
are we,
makes sense. Soft tissue. Yeah.
yeah. And then, then you get down to the fascia and the muscles, right? But before you can get there, you got to get through this first.
Well, and really that's what you're doing is you're moving adhesions. And my last class that I took
And
for
here's
CEUs,
adhesion, scar tissue right in
right,
here.
right. Yeah, and my last class that I took was lymphatic drainage. So those
Hmm.
are things. So myofascial work has been one of my most favorite tools. Not only is it easier on me, but it's so effective at reducing pain and getting things, to be able to move again. Um, and then, but it's piquing my interest because of all of the class that I just did for lymphatic drainage.
Okay. Okay.
So,
But you validated what I experienced. We didn't spend any time on loose connective tissue. They didn't, okay, this is it and that's it. I don't think they understood the significant role this plays in homeostasis because all these chemical reactions happen right here.
yeah,
It's the beginning. I'm just giving you a different viewpoint of it. That's all I'm doing. I'm just
yeah,
saying that, you know what, there's a possibility here. And maybe, we can impact 828 million. Why? I don't want to see people spend 10 or $15,000 when something can cost them 300.
definitely. I mean, as a horse owner, it's it's frustrating to look for answers and keep going from one practitioner to the next and spending money and not making, any headway.
I know. But I
Yeah.
thought this really depicted it really well. So, your comments, anything else, Estelle, that you want to say?
No, I'm looking forward to learning more.
Well, did I enlighten you today?
Yeah.
Yeah.
Good. How about you, Donna?
Yes. Yeah, you did. This is all just interesting learning about the abscesses and as I said before, laminitis. Laminitis affects so many horses.
Right. And laminitis is linked to metabolic syndrome too. Too
Yeah.
much sugar. And what's
Yeah.
happening in here? It's chemical, the biological, whatever the reactions are in here, it's happening in this space. Because you know what? The laminae in a horse's hoof is loose connective tissue. We didn't get into that. I'm just telling you it is.
Hmm.
It's called areola tissue, and it's the sticky stuff. So when you look at the horse's hoof and laminitis, what it is an inflammation of that connective tissue. And it's called areola connective tissue. And it's inflammation. And inflammation means the circulation has been impeded. So if you impede circulation, you're going to impede the lymphatic flow. So it's just a different way of looking at things. That's all this is. And then you see other possibilities that maybe you never saw before. So as you go down and do all of your, you go from one horse to the next, whatever you're looking at. I want you to think about this. How much is this playing? The skin here is being impacted by this. That's all. So now what I'm going to do is I'm going to close this off and I'm going to get up for you, Estelle, our website, and I'll show you where to do the research. Research. Where is it? I'm waiting for it to come out. Okay. Can you see this now?
Oh, yes. Oh,
Okay.
yeah, there we go.
Okay. So you're going to go to researches and then you're going to tab down to research.
Okay.
All right. And what we do is we give a free, be part of the research, and then you fill out the survey and you get a free consultation. So send me pictures of your mare and write the description so we could sit down maybe and figure out where you need to go with it. All right.
Okay. Well, and he's not really presenting with anything that I think um I don't know. She's well, I'll look over the questions and see.
Most of those questions are referring to extremities. So just if you skip what doesn't apply to you and just go down to the bottom where it says other and give me give
Sure.
me your
Okay.
synopsis, okay?
Sure.
Um,
Okay.
this here is a free lymphatic series. This is more of an in-depth review of what we just went over last week. I just took one sheet of what was in here. This is about 35 minutes, and it'll give you a wealth of information. This is the best basic professional curriculum for everyone, and it'll walk you through all the different changes, course 1, 2, and 3. And then we have here the lymphatic bundle here for horse owners. All right. And what is actually going on? So in there, you get the lymphatic, you get a horse owner's guide, you get a mini version of the equine lymphatic system there. You'll get to see, touch, and assess, and then you'll get access to the grooming technique. And here is the lymphatic flow. And we'll talk about that next week. And this is for horses that need to be decongested. We haven't put it online yet, but anybody has a horse that has, uh, chronic swelling that's not going away, the horse needs to be wrapped with a decongestive wrap. And we just put people's names in there who would be interested when it comes up. We have the videos, but it's not in a written format course yet. So we were just collecting names and people who need help. That's all that is. All right, so you see here, and the events, I will have my web developer put up the events for this particular series. I'll be sending that out him tonight. We were a little behind on that and see if we can get them up, but that's where it's going to be if you want to see any events. But here you will need this one research, Estelle, and then go to the lymphatic library. All right, and then we're going to go all the way down. We have the most common, the most viewed YouTube videos that we had. And then we have this is the professional curriculum. It talks a little bit about it. This is the bundle. Now this is how to identify lymphatic congestion. I would definitely tell you take 13 minutes and watch this. If you haven't done so, do it. Just go on there, identify lymphatic congestion, and you'll be able to identify it in a nanosecond, not even touching them. And this is the see, touch, and assess. This is going to tell you how to do it. All right.
Perfect. I'll peruse all of that. Thank
So
you.
this, yeah, you're welcome. All right. Is there anything else, ladies? Donna?
No, I'm all set. It was very good.
Okay. How about you, Estelle? We're good to let go?
Yep. Sounds good. Thank you.
Okay. So then what I'm going to do is now we're going to stop the recording. Well, we better have recorded this.